Welcome back to another episode of the WISBE Career Advice Podcast. I'm your host, Javier. Today's guest is someone whose story is not only inspiring, but packed with real, tangible lessons for anyone exploring a career in healthcare. I'm joined by Cody Hunter, president of Methodist Celina Medical Center and a lifelong learner whose career began in the most unexpected of places. From voiceovers to managing a donut shop as a teenager, Cody's path into healthcare started with a dream of becoming a pediatric cardiologist, but along the way, he discovered that his impact could be even greater on the business and operations side of care. Here are some highlights from the episode ahead.
So I got exposed to a lot of different aspects of medicine as a teenager, right? And it's just fascinating. And when I went into undergrad at A&M, wanted to go to medical school, I'd already kind of made up my mind of what I wanted to do, right? And it was pediatric cardiology, right? What I was most worried about and caused me to go explore some other courses, getting to the end of the marathon and not have enjoyed the journey. So I remember I walked in to my first 600 level health policy and management class, sat down through my first 3-hour lecture and said, hey, I found it. So I was incredibly lucky that, in the final semester of my senior year at Texas A&M, I found what I wanted to do for the rest of my life.
So whether you're thinking about healthcare leadership, applying for a fellowship, or just looking to hear from someone who's done the work and still leads with heart.
Don't let the world influence you. Don't let, what social media says you need to be when you grow up. Don't think that the only way to be successful in healthcare is by being a president or CEO. That's all farce, right? But you have to come and decide what's best for you, right? So I would say start there. Know yourself. So and make sure that you are the CEO of you, not with the board of directors, right? It is unilateral. You are the boss, and you got to make sure you embrace it.
In this conversation, Cody shares his journey through ER scribing, grad school, a competitive fellowship, and all the lessons he learned along the way.
Ask a lot of questions. That, I think, is the most humble and the safest way to do a couple things. One, when you're asking questions, it creates a safe environment in the event that you need to be able to provide some feedback, right?
Right.
And then two, it helps that individual understand that you're seeking to understand, you're seeking to partner, and you demonstrate by asking those questions that you don't know, but you want to learn, right? And then I would say the other thing, and we did this a lot as a team, is that in addition to asking questions, go put on your sneakers, go put on a pair of scrubs, and go spend a couple days on that nursing unit, in that project, back in the OR, whatever it is. Not only will that give you perspective of saying you've seen it, you've touched it, you've done it, but when you come back to drive that change, your street cred with the frontline staff is exponentially increased, right?
From managing hospitals through natural disasters to leading with empathy and navigating burnout. He also gives some of the most honest and practical advice I've heard for early career professionals.
But I would guide, graduate students or aspiring fellows or residents on a regular basis to say, if you have a personal statement and there's a question, answer the question in the first 2 sentences, right? And if it needs to be on a page or needs to be a certain number of words, do that, because you don't want something as silly as like going over 100 words or not answering the question or including the name of the wrong institution in your personal statement. That's an easy way when you have 200 applicants for one spot to rule somebody out. We're going to recruit top tier talent, and top tier talent can read a prompt, can follow the directions, can proof their work, kind of things like that. Even if you don't think you're going to get nervous, you're going to get nervous because it's literally the rest of your life. Write out those cheat sheets by hand, right? Yeah. What are the values of the organization? What's the mission and vision? What's the 5 coolest things that they did in the last year related to capital projects or programs or grant fundings, right? Write out on the piece of paper your 3 strengths. Write out on your 3 weaknesses. Write out what you want to be when you grow up and how this organization is going to help you get there. Because if your eyes are shifting down to read your notes because you got stalled, they're not going to notice that on a Zoom. So again, you talk about what you can control. Prepare for your interview just like you would prepare for your final exam.
Whether you're clinical, administrative, or still trying to figure it out, I think this will be a conversation you'll enjoy.
Yeah. So, but yeah, really, going through acting and things like that, I think, part of what we do as leaders, translates into being able to tell stories and present well and things like that. So, it's so funny. You build on all of your experiences over your life to be able to get into the roles that you're in today or into the roles that you want to be. And so, who knew when I was in the sing and dance group, Sunshine Generation, right, that would
it's a great name.
Some of my personality and, kind of some of my confidence and ability to talk in front of people. So yeah, it all built over time.
That's awesome.
Yeah.
You never know where you're going to, but everything we do leads up to who we are today, right?
100%.
So,
and then, in high school, I was great at sports until everybody got taller than me. And so I translated then and moved over and decided to start working. So I took my first job at 14 at Dunkin Donuts.
Nice.
Dunkin Donuts is still there in Austin. And it was wonderful because, since I started so early, by the time I was 16, they made me a supervisor and then I hired all of my friends.
Wow.
So it was the best job you could ever have, right? Going through high school, because you always had something to eat. You worked with all your friends. And so it really taught me, again, a different part of customer service, right? Again, I don't know about you, but before I have my first cup of coffee, I'm not always the nicest person in the world, a little grumpy waking up, right? So it kind of taught me kind of the difficult aspect of customer service, of managing people's expectations and when they're not in the right mind. Again, one of those weird translatable skills that we use in healthcare of kind of how you manage the customer, and whether that's a doctor or a patient or anything like that. And the other thing is when I went to school at A&M to get my bachelor's of science in biomedical science, I would come home in the summer to do summer school at Austin Community College, because, the trick at A&M is if you take community college, the grades don't transfer, but the credits do. So I took all my hard classes like physics and things like that.
Good to know.
But I came back to Dunkin Donuts in Austin in the summertime, and I would bake at night. So I'd go in at 11 p.m. at night. I would bake all night, and I'd usually finish up about 4 o'clock in the morning. And so I was paid to study for a couple hours. And again, like any college kid wants, I got paid, I had a chance to study, and I always had something to eat. So kind of thinking back about, starting that role at 14 and then being able to finally hang it up when I got my first, I'll call it big kid job in College Station when I was 21, turned out wonderful.
That's amazing. That's a great story. And so what was your first healthcare job?
Yeah, that's great. So I originally went in thinking I wanted to go to medical school. I started studying biomedical science as an undergrad at Texas A&M, which is a great foundational science degree. And doing all the prereqs, focusing on coursework and starting to volunteer and things like that. And actually, I started to volunteer at a hospital called College Station Medical Center. It was affectionately called the Med. It's since changed names since I left town, and was volunteering there in the ER and had an opportunity to develop relationships with a wonderful group of ER doctors and ER nurses, and came to found that they had an ER scribe program. That's when we were still on paper, T-sheets, had to follow around, populate the notes, all those things. And
Come a long way.
A long way, right? We went from paper T-sheets to passive listening in the operating room now. So it's amazing to see kind of technology over the last 20 years. But had an opportunity to be a scribe with a wonderful group of ER physicians that I was one of the few that eventually did not go into clinical bedside postgraduate degrees. I went into administrative degree. Obviously, I have my master's in health administration from A&M, but by being that scribe, it helped me develop my doctor speak, right? And with the great group of ER physicians I worked with, kind of when we were working deep nights or had a slower day, they would teach me things like how to read and interpret lab work, how to read x-rays and CT scans. They would kind of guide me through, even though they knew I was going to end up in kind of the business side of healthcare, they would guide me through and teach me the same things that they were teaching the nurse practitioners or the doctors or the nurses. And so I really, again, building on all those experiences, right, from Sunshine Generation to sitting in the president's seat now, that doctor speak that I had for the 4 years that I worked for them in College Station helped me understand, one, the science of what we do in the business, right? But two, it causes me to makes it a little bit easier for me to have more relatable conversations with our medical staff, right?
Yeah.
I can appreciate what a bad day is in the ER because I've lived it, right? I didn't live it as a hands-on clinician, but I lived it supporting all of those clinicians, right? And that's a high volume day. That's somebody passing away. That's, the birth of a baby in the back seat of a truck and the circular drive, like all these kind of momental experiences I had, I think allows me not only to relate to the medical staff, but be able to really lean in on our clinical staff and our department staff in the hospital to sympathize and empathize with both the highs when I had a great day, and I know why, because I felt it, or when we're having a really tough day and, helping identify when we need to lean in.
That's amazing.
Yeah.
So when you were a scribe, was that when you knew that you wanted to be in healthcare administration and you wanted to go through that path, or was it earlier on? Because you had your degree already.
Yep.
So talk me through that.
And it's so unique because everybody has a different story of how they got into medicine, right? Whether it be on the business side or research or hands that heal or thoughts that think, whatever it may be, right? So I was a big healthcare consumer as a child, right? Had a heart condition, spent some time at Texas Children's, all of the things that come along with that. So I got exposed to a lot of different aspects of medicine as a teenager, right? And it's just fascinating, right? And, when I went into undergrad at A&M, wanted to go to medical school, I'd already kind of made up my mind of what I wanted to do, right? And it was pediatric cardiology, right? Because those were the men and women that helped care for me when I was going through kind of my issues as a teenager. For me, when I was making that decision about, hey, do I keep going down the path of kind of pursuing that MD or that DO and the fellowship and everything that goes along with it, or do I look at something different? That's really where the ER doctors that I worked with challenged me, right? And I'm so glad that they did. Every ER doctor that I worked with at the Med absolutely would have done what they did over again if they had the chance, right? But so many of those doctors kind of talked me through the personal challenges or the personal reflections that they'd had on their journey. And I'll give you just a couple examples. So one of the ER doctors had both of his kids in residency and missed the early years of his kids growing up because of how busy he was in rotations and things like that. Yeah. Again, still had a wonderful relationship with his kids and his wife, but those are things that you can't get back, right?
Absolutely.
Another doctor that I worked with, his passion was horticulture, right? And he chose to go to medical school, right? He still got to practice his passion more as a hobby, but it wasn't what he did for his whole life, right? He was a phenomenal doctor and he trains at the medical school and just a great doctor, but that was his story. And then the third one I most remember that resonated with me is that there was a doctor that was double boarded in peds and internal medicine or adult emergency medicine, just a phenomenal human being and just a great doctor. He told the story that his brother, who was a couple years older than him, decided to not go to college, right, and pursue a craftsman type role as a plumber. Right. And, Dr. Kraft, eventually decided to go to medical school. That's who I worked with. And he looked back and said, hey, my brother and I are both successful. We're both very blessed, have wonderful lives, all those things, but my brother, has a whole lot better quality of life than I have now and makes a crap ton more money because he became a master plumber and created his own franchise and owns his own company, right? And not that he was envious or jealous of that. He just shared that as perspective, right? Yeah. And so that really kind of made me pause and take a step back and say, okay, hey, what do I really want to do with my life? You're 21 years old, right? I had no idea, right? Sometimes I still don't know what I want to be when I grow up, right? And I'm almost 40, right? But, looking at 21, what I was most worried about and caused me to go explore some other courses like architecture and public policy and eventually kind of settling into my master's courses at A&M and health administration was I was worried about two things. I was worried about getting to the end of the marathon, which I would just be getting to the end of the marathon right now, right, in terms of how old I am, and not have enjoyed the journey or realize that I get to the end of the marathon and realize that's not what I want to do for the rest of my life. Right?
That'd be tough.
I mean, because you've invested over a third of your life in getting to something that you don't know what the end game is going to be. And then the other thing I was worried about is having worked full time and AP classes and grinded out, in college and worked full time, while I was at A&M, I was worried that I would flash out or burn out before I got to the end of the finish line, right? And then what do you have to show for it if you only get halfway there being a doctor? Well, you can't be a doctor if you only get halfway there. So I was worried about more of a personal thing for me of not having the energy in the tank to get over the finish line, or getting to the finish line and realize I ran the wrong race. I remember I walked in to my first 600 level health policy and management class. It was then called the School of Rural Public Health at A&M. It's now part of the School of Medicine or Health Science Center, and sat down through my first 3-hour lecture and said, hey, I found it. Right. So I was incredibly lucky that, in the final semester of my senior year at Texas A&M, I found what I wanted to do for the rest of my life. My opinion, once you find that, right, and not everybody has the luxury of finding it their entire life, but once you find that, it makes it so much easier, not just to learn the content of what you're studying, but appreciate the concepts. And if you master the concepts, the content's easy, right? So for me, graduate school was really easy because I knew all of the concepts that we were working on were things that I was going to translate into skills into my job. And so since I started my graduate studies in my last semester of my senior year undergrad, I was able to kind of spread out my graduate hours over the same time period, the 2-year time period. So I was able to work full time, all those things. While I was at A&M, they require a 10 to 12 week summer practicum. in between kind of your first and your second year. So I had the opportunity to apply for a competitive summer internship at Duke University Hospital in Durham, South Carolina. Durham, North Carolina, and had an opportunity to go join that team when the medical home concept back in 2009 was just coming to fruition, right? So had an opportunity to be on the ground level floor at Duke while they worked with kind of the local counties, Durham counties and others, on high utilizing diagnoses. Think about people with end-stage renal disease, sickle cell, some of those other kind of recurrent, uncurable, high healthcare utilizing diseases. And we worked with their Medicaid program there to really identify how do we get these folks the preventative care that they need so they're not always accessing the ER in crises. So that was really cool to, be able to walk away from that with that experience. And then the program at Texas A&M is very much focused on postgraduate residencies and fellowships. And so at the time, our program director was really boom or bust on that, which I'm glad he was. And, this is going to sound a little strange, but, we set targets as individuals in our graduate program to apply to 20 or 25 fellowships or residencies, right?
Sure. Yeah.
And that was before NAFCAS, right? That was before online applications. So I would literally, over the course of the month I was doing my applications, would go to the post office, with a stack of, kind of prepaid envelopes with, the folder and the business card and the resume and the personal
statement. A lot more physical effort involved.
It's huge, right? I think I spent like $300 on shipping just to get my applications out. And I was very lucky that I had a chance to get to final round interviews for a number of great organizations in the United States, Barnes Jewish, St. Luke's in Houston, what is now Houston Methodist in Houston, UAB, and then Johns Hopkins. And I was lucky enough to get offered a position. Those positions are really hard to get to because of how competitive they are, with Houston Methodist. But then it was called the Methodist Hospital System. So I had an opportunity to join Houston Methodist in July or June of 2010 and did 18-month rotational operational fellowship with them. And again, timing is everything. When I started my fellowship, I had an opportunity to meet a very close friend and mentor of mine, a gentleman by the name of Wayne Voss. And Wayne was building Houston Methodist West in Katy, brand new hospital for Methodist. And he was the first executive I met when I was making my rounds after figuring out where the parking spot is, get something to eat, and where the bathrooms are. And Wayne said, "Hey, do you want to come spend some of your rotations with me and help me get this hospital out of the ground and started?" And I immediately said yes.
Of course.
And that was really the beginning of what I would call my big kid career, right? And so got to partner closely with Wayne and the team to open Houston Methodist West. We opened December 17th, 2010. And that gave me a lot of the beginning of my stories, right? How to manage change management, how to manage stress, does the hospital operate, right? I mean, you come out, out of graduate school thinking you can conquer the world, and then you get slapped in the face from the workforce, right? And a couple people have to knock you down a few pegs to make sure you don't know.
Absolutely.
Right?
Absolutely.
But the benefit from Methodist is that, they started their fellowship back in the early 70s. And so they knew that we didn't know as fellows, and they created a really great environment for us to learn and rotate in. So did my 18-month fellowship, came out of the fellowship, started as a project manager at Houston Methodist West working for Wayne. And then he promoted me after a little bit over a year to director of business development and patient satisfaction. And that's kind of a weird matching of roles.
Yeah.
But he did it intentionally. And I'm forever grateful for this because he knew, having developed a number of leaders before me, that one, you have to be able to grow the business and have physician relationships and be able to, drive change and drive adoption and drive volume, all those things. He said, but you can't move to the next level without some of that hospital operational responsibility, right? So I had business development, food services, and patient satisfaction.
Oof.
Right? So kind of a weird smattering of things.
That's some heavy hitters.
It was great because, it taught me business, right? Because, you got to manage your net cost per patient day and how you're delivering food service. Patient satisfaction is huge because I had the opportunity to manage the input, right? The doctor, right? And how he or she takes care of their patients. And I got to evaluate the output of not just that physician, right? But of the whole service, emergency department, inpatient, all those things. So that was really great. And I had a number of phenomenal nursing leaders take me under their wing. Vicki Brownwell in particular was our chief nursing officer at that time. And her and I really bonded. And so she taught me the right way to lead alongside clinical staff so that you don't have a we versus they, right? You speak their language. And she gave me some really powerful feedback early on, really about that teamwork and how to set expectations and how to drive accountability. Because again, patient satisfaction relies so much on the clinical hands, right? And that was really my first opportunity to learn how to lead through influence versus direct line accountability, right? You're a 24-year-old, kid just getting out of graduate school, and you go talk with a 20-year tenured nurse leader, right? You can envision how that conversation can go really, really poorly or really well.
Yes.
Right?
Yes.
And you learn a lot from the poor conversations, right?
You should.
But you get a little bit of patience being so young. And so I had an opportunity to be in that director role for about 2.5 years, and then got tapped for an associate administrator role at Houston Methodist Willowbrook, which is in Northwest Houston. And that was really my first, I'd call it kind of big kid, kind of quasi-executive role. And so had an opportunity to lead over 300 FTEs, worked very closely with the CEO and the administrative team on capital expenditures, and just kind of expanded my scope into things like imaging and EVS and facilities and things like that. And it was a really great opportunity for me to start settling into my executive style and presence, and got to weather all kinds of crazy things while I was there. I mean, there was April tax day floods, there was Hurricane Harvey. I mean, lots of big emergency things.
Yeah.
And, those type of things really stress, hey, have we done the work in emergency management and preparation and all of those things? And I could talk about my time during Hurricane Harvey forever. But that was just it was a surreal experience to be a part of. And I don't think any other disaster, at least I hope not, will ever surmount to kind of the impact that Hurricane Harvey had on healthcare infrastructure, people, community, all those things. It was crazy.
Yeah.
And then I was in that role for almost 3 years. And then our system CFO at the time at Houston Methodist, Kevin Burns, needed some help working to support our system president's mission, Dr. Mark Boom, of acting and behaving more like a health system, right? Like any health system, right, that develops, you have individual markets and you have to make nuances and moves and adjustments kind of to be nimble in your own market. But what Mark recognized is that, we had opportunity to be better, more efficient, and scale if we acted more intentionally together. And so Kevin brought me in, and we created a system level department called became the director of internal consulting at Houston Methodist, right? Okay. And so if you think about it, lots of large health systems, because of either speed or lack of content or lack of ability, will bring in third-party consultants, right? Yeah. Third-party consultants do a phenomenal job, right? They help you with very specific problems and strategy and things like that. But what we did at Houston Methodist is we said, hey, we spend quite a bit of money on consultants, and we pay for them to come back in and solve the same problems every 3 or 5 years, right? Like, that's kind of the definition of insanity, right? You do the same thing over and over again and expect different results. And so what we did is we kind of took a step back like we did in Houston and said, hey, what can we do differently, right? We know we need to improve upon things like length of stay and efficiency and patient status management, and what are the ways that we can better optimize Epic and referral management and things like that. And so what we did, I wouldn't call it novel, but it was unique and new for me, is that, working alongside Kevin and the senior leaders in Houston, we said, okay, hey, what are the hard problems? What are the ones that we are either really difficult, really emotional, that we've tried to tackle before that just haven't been, they're not sticky, right? We fix it for a time and then we go back to our old ways. And we identified a number of projects that my team was able to deploy. And it was great for me from an accountability perspective because, it was the hardest job I've ever had and the easiest job at the same time, because from an easy perspective, my accountability was very clear, right? I identify and work on projects that return at least 5 times my team's operational expense, or I don't exist. So it was easy, right? My true north was there. I knew exactly what I needed to do, right?
Yeah.
And what it did is it helped me, working alongside Kevin, triage the right type of projects, right? Because we all working in healthcare and health systems, there's a million little things.
Sure.
Right? But you can't tackle a million little things that are only $1,000 a piece. You would rather tackle 1 or 2 things that are maybe worth $5 or $10 million. Right. Might be a harder lift, take more time, all those things. And so the accountability part was easy. What was incredibly hard is you go into somebody else's shop and you point out the things that maybe they can do better and the things that you want to help them fix, right?
Yeah.
And for me, because I'd been with the system for 8.5 years when I started that role, I started, I think, from a very advantageous point is that I had a lot of those foundational relationships. I went through the fellowship. I had an opportunity to work and get to know the executive team. So I think my journey in that role was probably a little bit easier than, say, if we hired somebody from outside.
Absolutely.
But still, I mean, again, remember, I'm 30-something years old, right? I'm a director role, right? You're walking into an executive or a senior executive's office and saying, hey, I found this thing, or hey, we tried to do this thing before at your hospital 3 or 4 years ago. It's not performing well, or you're not performing with the metrics, right? So that one taught me how to craft myself and how to carry myself to not just sit and watch at the big kid table, but start to be a participant, right?
Yeah.
How do you share creative content? How do you help guide the conversation? And then, really you had to put my money where my mouth is, right? To be able to say, hey, let me come in and prove it to you, right? And, that is, a conversation that you still had to go convince, right? It wasn't Kevin picking up the phone and saying, you shall work with Cody. It was Kevin supporting the idea and saying, hey, Cody, go sell it, just like any other consultant would.
Right.
And so we had great success during the 3 years that I led that service. We put $30 to $40 million back on the bottom line. We identified some significant macro level issues that were impacting patient access and navigation. We did a lot of work on patient status management because, it's really expensive to build hospital beds, right? I think we're up to $1 million a bed when you talk about expanding nowadays.
Yeah.
But if you're inefficiently using the resources that you have, that reduces your capital burden, right?
Right.
And that was one of the things that we spent a lot of time on in a few of our facilities is to say, hey, everybody recognizes facility X that you may need a new bed tower, may need a new unit. But part of the sales pitch, right, to go secure those capital dollars you need to be able to showcase how you're using your assets that you have today in the most efficient way. And so we leaned in, and a lot of the presidents and CEOs leaned back with us to kind of help craft that and evaluate it and all those things. So that was really great. But it was total leadership through influence.
But so when you're doing that, looking back on it now, someone coming in that that's just going to be put in that spot, doesn't have that tenure with the organization.
Yeah.
How would you have approached it differently?
Yeah, that's a really great question. And one of the things, and if my team watches our conversation today, they'll laugh at this, is my advice directly to that question is ask a lot of questions. That, I think, is the most humble and the safest way to do a couple things. One, when you're asking questions, it creates a safe environment in the event that you need to be able to provide some feedback, right?
Right.
And then two, it helps that individual understand that you're seeking to understand, you're seeking to partner, and you demonstrate by asking those questions that you don't know, but you want to learn. Right. And then I would say the other thing, and we did this a lot as a team, is that in addition to asking questions, go put on your sneakers, go put on a pair of scrubs, and go spend a couple days on that nursing unit, in that project, back in the OR, whatever it is. Not only will that give you perspective of saying you've seen it, you've touched it, you've done it, but when you come back to drive that change, your street cred with the frontline staff is exponentially increased, right?
Right.
And again, it's how you sell it, right? It's, hey, why are you here? What do you want to do? How do you want to accomplish it? And so I think crafting that message, whether you're internal or coming into the role external, I would say spend a lot of time mastering your stories, right? And being able to plan those conversations and kind of role play it with yourself, right? I still do a lot of role playing today, right? Yeah. And that's through training I've had with things like Crucial Conversations. That's through, hey, I had this similar conversation 6 months ago. Let's think back in my head. How did it go? Like, do we want it to go the same way? Do we want it to go different? And so I think, asking lots of questions, rolling up your sleeves and kind of getting down in the trenches and spending time, and then kind of helping build the why with frontline staff and leadership alike, I think it would be a great way to matriculate into a position like that director of internal consulting role.
And also, if I take a step back as to when you first started in the healthcare administration, it would seem as though, from what you say and some of the generic things that you might hear around about leadership and getting into healthcare administration, similar things would surface, right?
Yeah,
I would assume getting in, get your hands dirty, know what the front line is doing. I mean, you benefited from the scribe work that you did.
Yep.
Not everybody's going to obviously come from that. And that would lead me to a different question of, outside of being a scribe, what other healthcare professions or jobs at a hospital do you think can really set people up for success in healthcare administration?
Yeah, I think I'll answer the question a couple different ways, right? Because I think it depends on what you want to see or what you want to see yourself doing. And again, if you love finance and want to do finance in healthcare, again, getting your foot in the door, whether you're an undergrad or just coming out, with a degree or thinking about what you want to do, go work in front-end revenue cycle, right? Go be a patient access representative on night shift in the ER full-time, right? And seriously, you see everything, right? And you get to understand the importance of insurance and why it works and the flow and all those things. And again, like most ERs, you'll get a little bit of downtime between kind of 2 a.m. and 4 a.m., not all of them. And so if you're there and you're intentional about developing your relationships, guess what? You're naturally going to get to understand and create that opportunity environment for you to ask questions. Well, why do we keep a trauma bay like this? Or what do we do if we get a call like that? Or how can I help kind of in the next code? There's all kinds of things. And based on the hospital you're in and the department you're in, there's going to be guardrails for all the right reasons, sure, right? But I would say, hey, if you're thinking more business, if you're thinking more finance, revenue cycle, go apply to a patient access role and just get your foot in there and get the experience. It'll help you with your stories. It'll help you get a better understanding of how the world operates. And then again, if you're thinking about some more kind of operational leadership or clinical leadership, sometimes those entry level jobs can be really hard to get into without your certificate or professional certification. And that's just kind of one of those cart before the horse phenomenons.
Right.
But without the certificate, there's still so many things you can go do, right? While you're going to school, all those things. And the easiest path, I would say, is volunteering, right? And if you can just get and go volunteer, again, front desk of the ER, be responsible for wayfinding, participate in projects to help support the staff, that just gives you more and more opportunities to ask questions and be able to see what it feels like. And, at Methodist Health System here in Dallas, we have the opportunity to work alongside people like Collin College and a lot of the local ISDs. And just recently had an opportunity. We toured a number of the students, both high school and middle school, from the local school districts at Methodist Celina before we opened.
Oh, nice.
And, part of it is just get them exposure. Like, what do you want to be when you grow up? You're 16. That's great that you know what you wanted to do. I didn't know what I wanted to do when I was 21. But I had an opportunity to run into a graduating senior from Celina High School just recently at a graduation event, and she got a scholarship and got recognized for her academic performance. And she was one of the young women that came through and did the tour with me and all that stuff. And I told her, I said, hey, did you decide what you want to be when you grow up? Right? And she looked at me and she goes, well, I don't want to do medicine anymore. Right. And I kind of laughed, right? We talked about what she wanted to do. She wanted to go into history and be a museum curator and all that stuff. Right. And I smiled at that because, this young lady who's 17 or 18 years old, who thought she wanted to go to medical school, because of that opportunity to get that exposure, even though it was just a 2-hour tour, right? She was like, no, that's not for me. I don't want to do it, right?
Yep.
And so you look at that and say, okay, it's a wonderful opportunity for us as healthcare leaders to lean back in and help, because so many people help us on the journey that we're on. And I just thought that was kind of a unique situation, talking about experience and what do you do to get exposure to it. Sometimes that experience and exposure that you may get may rule out things that you want to do, right?
Yep. And that's interesting, because one of the topics that I feel like is obviously prevalent all across healthcare is the labor pool, right?
Yep.
Trying to get more people into healthcare. What do you think someone's trying to get into healthcare? Not everybody does tours like that, obviously, and
they should.
Yeah.
Yeah.
Anything that you can tell either high school or college, if you're just now like trying to figure out, do I talk about your time and the sunk cost that some people might be fearful of doing and not liking it.
Yeah.
I feel like, is volunteering the main way to do it without trying to fully commit?
That's a really good question. I think volunteering is always a great way to go try it on for size, right? And a number of hospitals and health systems will have kind of teen summer volunteer programs.
Okay.
That, hey, even before you graduate high school, they're typically a competitive application process, but you can go spend 15 hours a week, 20 hours a week supporting volunteering while you're in high school. The other thing that I was able to take advantage of a little bit when I was in high school years ago, that is way more prevalent today, is dual credit courses. And I think most of the community college that are going to be around where you go to school or regionally close will give you an opportunity to do those dual credit courses. And I think that, especially in my opinion, for people that want to pursue clinical degrees, nursing, lab medicine, become a physician, whatever it may be, one of the things I always challenge young people with that, and what I think dual credit courses can help you on, is that if you don't love the science, doesn't mean you can't be a doctor, right? Doesn't mean you can't be a nurse, right? But I think you should take that intentional pause and make sure that, knowing that the journey is so long, that you can digest 16 hours of science classes times 2 semesters a year for 11 years, right?
True. Yeah.
Dual credit gives you the opportunity to do that kind of in a safe and insulated environment. And then if you do love it, great, you're bringing way cheaper credit hours to university.
Right.
And if you don't like it, you really haven't lost a lot.
True. Yeah.
So,
and I think the same thing about anybody that might be interested in healthcare, but don't like some certain aspects of the medicine and want to be technologists, a scrub tech or an imaging tech that doesn't have to do the same things that a nurse might do or a doctor might do, and shorter time frame on the educational side. Yeah,
100%. I think that's what's so powerful about a way a number of the colleges have structured dual credit courses today, is that there are more than you think, a larger number than you think, seniors who are graduating high school today with their full associate's degrees. And there are so many positions in healthcare that either require only certificates or 2-year associate's degrees. And, going to undergrad and going to graduate school or going to medical school doesn't have to be for everybody, right? If it's not for you, that's totally okay. You can still have an incredibly successful career in healthcare and in medicine without a 4-year degree, without a master's degree, without an MD or a DO after your name. And so I think going through those associate's degrees and getting things like your patient care tech, or your certified nurse assistant, or your EMT basic or paramedic, like there's so many things that allow you to come out at just 18 or 19 years old and be able to start trying on for size the hands that heal. And even if you do decide to go and finish your bachelor's degree, guess what? You have a skill set that allows you to go get a great paying job while you're going to school and continue to get more healthcare experience.
Absolutely.
And I think that, talking about working while you're going to school is one of the things that, I got to give credit to my mom, right, about really encouraging me to do, is that when I was going through undergrad and I was going through graduate school, I worked full time at the Med, or had an opportunity to do my internship at Duke, like we discussed. And that gave me such an easier path to bring the concepts into the workplace, which I think helped me master those things. Same thing goes for dual credit, or while you're going to undergrad for nursing or whatever it may be. If you can work in that space or volunteer in that space, it allows you to see more and learn more what you're studying in the classroom.
So when you're talking about your internship and you're talking about how you were, part of a group of people that you put your applications out there in a very competitive environment. Yeah. I still think today I don't know if you feel like it's more competitive today than it was before, but some people might say that it's, if not the same, a little bit more difficult.
I'd probably say it's more competitive, right? Because I think what's happened to, and I don't have factual information to back this up, this is just a feeling, is that, if you go look at NAFCAS or ACHE.org and you look at the fellowship or the residency spots, I think there are less today than when I went through this almost 20 years ago, right? Because you think about it, those are investment and training programs, right? Similar to graduate medical education and things like that. The organization has to have the ability and the interest in making that investment.
Sure.
Right. And, in the times of declining reimbursements and changes in Medicaid and just total cost pressures, right?
Right.
If you don't have a need for a pipeline of, executive leadership or operational leadership, and you're looking for a way to reduce your expenses, well, hey, we may take a honeymoon or a sabbatical from doing a fellow or a resident, and then you have to go justify to add it back a couple of years later, right? So I do think there's a growing number of people who are interested in those roles and a declining amount of available spots, right?
Yeah.
I do think, though, and I had an opportunity when I was a fellow in Houston to be a part of that initial review committee for fellows. You have to have all your T's crossed and your I's dotted, both literally and figuratively, right? And so when you look at whether it be a job that you're applying for, or a fellowship or a residency, there's sometimes a personal statement, sometimes a resume, sometimes a cover letter. Each of those things are a little bit different. But I would guide, graduate students or aspiring fellows or residents on a regular basis to say, if you have a personal statement and there's a question, answer the question in the first 2 sentences. Right. And if it needs to be on a page or needs to be a certain number of words, do that, because you don't want something as silly as like going over 100 words or not answering the question or including the name of the wrong institution in your personal statement. That's an easy way when you have 200 applicants for one spot to rule somebody out.
Yeah.
Right. And it's not being, aggressive or mean or anything like that, but it's like, hey, like, we're going to recruit top tier talent, and top tier talent can read a prompt, can follow the directions, can proof their work, kind of things like that. But yeah, I mean, fellowships are incredibly competitive. And what the advice I give to, folks that are interested in that fellowship or residency path is that, the hardest part is getting to that interview, right? So if you can get to the interview, pretty obvious when you look at the math, but your chances of getting it go way, way up, right?
Of course.
But the other thing that whenever I have interns rotate with me or students from Texas A&M spend time with me during the summer, the other thing that's easy to get behind on that they don't realize because they've never done it before is really two things. One, when you're applying to fellowships and residencies, the only grades that matter are your grades in your first year. So you better break your neck to get a 4.0, right? Because that's a way to differentiate yourself. Because if you think about it, you apply in the fall during your second year of graduate school, you're going to go through interviews and hopefully get an acceptance before your fall semester grades even come out. So spend the extra time and effort in your first year in graduate school to make all A's, because that's only going to make you look good. And you don't realize that. I had somebody tell me after I grinded, in my spring semester, and I was like, yeah, I got a 4.0 my fall semester in my second year. And they were like, but it doesn't matter. And I was like, what do you mean?
No.
Like, oh, you're right. Right. I still hustled through the end of my degree, but that's just kind of one of those nuances, and then the other thing too is that, I think too often, even though the programs talk about it and lots of people are interested in fellowships and residencies, it sneaks up on you. And so one of the things I intentionally work on with our interns over the summer is that by the time they leave me in August, usually a couple weeks before the semester starts, we will have everything done for every single one of your fellowship applications. You will have your personal statements done. You'll have your resumes built specific for the role. You'll have all your letters of recommendations done, and they will be submitted. And that will be a part of your evaluation for your internship for me. Because you know what? If you don't want to be spending time finishing your fellowship application while you're getting ready for your interviews, you want to have distinct time and difference between that, right? And you also got to take care of yourself. So if you can take a couple weeks downtime, right, and finishing your internship and starting, back graduate school again. So that advice, I think, has really led a lot of the young folks that I've had a chance to mentor really to have success early on and getting those residency and fellowship roles. I don't know if that's a secret sauce, but those are just kind of two things that you as the individual can take complete control of. Sure. Get that 4.0 and get your stuff in early.
Do you think that the opposite of that is what most people do wrong that don't get in? Or is there something else that you see people doing that you should definitely avoid this or don't do this?
Yeah, I think the more avoidance really gets to the interviews, I think.
How so?
I think nowadays, when I did my fellowship interviews, it was all on the phone. We didn't have Zoom. We didn't have FaceTime and all that stuff, right?
Yeah.
And so one of the things I did, if you do end up having a phone interview versus a Zoom interview, is for me, when I did all of my interviews, and this was a personal thing, is when I'm in a full suit with a tie, that is when I feel the most confident. So I was sitting in my room with my three other roommates in College Station, right, doing phone interviews, right, in the middle of the morning or in the evening or whatever. They couldn't see me, but I was full suit, tie, shoes polished, ready to go, right, because that's what I needed to do. That's what helped me make it feel most comfortable, right? And goes back to a little bit of advice I got in that first graduate course that I told you I took. We had a duck analogy that was shared by the professor, Dr. James Alexander. And, he would challenge us all the time. He said, guys, if you want to be a duck, referencing a hospital CEO or a hospital leader, you have to act like a duck. You have to walk like a duck. You have to dress like a duck, and all these things, right? And so I really embodied that for my personal thing, is to say, hey, like, if I want to be in that seat, I need to dress and look like I want to be in that seat, right? And I think the same goes even for Zoom too. Don't find your Zoom background, kind of like what we have today, right? Don't have your ceiling fan and your cat jumping over your shoulder in your interviews, right?
Oh, yeah.
And so really focus on that professionalism, right? Don't be stale, don't be rigid, but be the best you in those interviews. And I think the other thing that I guide folks on, especially when you get to that interview phase, is be authentic, right? We get so focused, especially when we're young in our careers, of I want that role and I'll give up anything for it. Going back to my personal story of being worried about getting to the end of the marathon and realizing that I hate it when I got there, that's the worst thing that could happen to you as a young person getting into residency and fellowship, is that you get there and you're like, what did I do? Right? I hate this place. I don't like my boss. it's freaking cold or it's hot or it snows all the time or it rains, right? Those are all things that sometimes we skip out on, right? That I think, the newer generation of graduate students are coming out on are way more focused on the life aspect, right? And the enjoyment aspect than I was. I got lucky, right? That I got in a great place in a great state with a great organization. But I talk with folks all the time, especially as we're doing that fellowship preparation. One, think about where you can live, but more importantly, think about where you can't live, right? If you hate snow, don't apply to fellowships in Minnesota, right? Great organizations there, but if you can't be happy there, don't do it, right? And so, I think, when you talk about more ruling out or ruling in, I would say dress for success. That's what you can control, right? Control your environment, right? On where you do those interviews, find the quiet space, find the appropriate location, and then do the preparation. And when we talk about preparing for interviews, and I still do it today whenever I interview for roles, is especially when you're on Zoom, I don't know if the camera can see me, but nobody can see what's sitting on your desk if you're talking into the camera, right? And the easiest way to prepare for those interviews, especially knowing that even if you don't think you're going to get nervous, you're going to get nervous because it's literally the rest of your life. Write out those cheat sheets by hand, right? Yeah. What are the values of the organization? What's the mission and vision? What's the, 5 coolest things that they did in the last year related to capital projects or programs or grant fundings, right? Write out on the piece of paper your 3 strengths. Write out on your 3 weaknesses. Write out what you want to be when you grow up and how this organization is going to help you get there. Because if your eyes are shifting down to read your notes because you got stalled, they're not going to notice that on a Zoom. So again, you talk about what you can control. Prepare for your interview just like you would prepare for your final exam. So look the part, look like a duck, right? Act like a duck with preparation, right? And then control your environment. And going back to the analogy, control the pond you're swimming in.
Okay. Bringing it back. Yeah, that's good.
Yeah.
So one of the things that people have said over the course of the interviews that I've done is the last piece that you didn't mention was extracurriculars. Yes. And they've said, people that I've spoken to have said, it's almost as important to know that you have something going on outside of healthcare as well as what you expect to achieve inside of healthcare because of how much burnout is a big prevalent topic. Yeah. Mental health is a big prevalent topic. Yeah. How do you feel about that?
That's a really great question. I couldn't agree with you more on kind of having things outside of work too. Healthcare, not in a bad way, but healthcare can consume you, right? There's always so much more we can do. And I think that drive for people that are in leadership positions or clinical bedside positions is making people better, right?
Yeah.
And people get sick and people need help 24/7, 365, right? But that burden can't fall on you 24/7, 365, right? There's different roles that make you have to be more available. Like I'm on call with the hospital today, right? So my ringer's up high, right? I haven't pushed on ring through and I got to be available 24/7 for the next 7 days, right? For administrative call, right? So again, your role kind of defines how much you allow healthcare to consume you. But I think by really leaning in and identifying your passions or extracurriculars or family or faith side of things, I think what that does is it helps me for sure set guardrails, right? And, I'll give you one example. My son, he plays club soccer and I take him to practice every Monday and every Wednesday evening. And that's no ifs, ands, or buts, right? And he knows that he's allowed to give me a hard time about it. We were 8 minutes late to practice Wednesday, right? And he told me about it the whole 20-minute ride. And so, but you look at that and say, hey, like, how cool is it that I've leaned into a sport that I played that my son loves, and now he's my accountability partner, and not only just for him and his experience, but helping me set my guardrails, right?
Yeah.
And then the other thing too is, especially as you move up the leadership journey, right? When you go from frontline staff to manager, director, executive, senior executive, whatever your path is that you need to identify those ways that you can integrate work and life together so you can do both at the same time, right? You still have to have your barriers so you can unplug, right? But like as an example, I serve on the board of the Celina Education Foundation, right? And we raise a lot of schools for a lot of money for scholarships and support the teachers and things like that. Well, that's great from a brand perspective for the hospital hospital to be that involved in the community, right? And so I'm hopeful with my work that I'm doing, not just to better the brand of the hospital, but bettering the education foundation, that my kids or another child or another parent or a teacher in the district, right, can take advantage of the work that I'm showing. And I get a lot of personal pleasure around serving in those capacities. But, the other thing is, going back to mental health is real, right? And I think as leaders, we have to talk about that. And I'll share a personal example, right? Just to really kind of start the story for everybody to talk about it, is like most super type A's in this business, I have high functioning anxiety. Now, I've learned over the years how to manage that and decompress and all those things, right? But, people look at me when I say that and they're like, "What, you? Right? You have anxiety? Like you carry a rescue med in your pocket?
You're a human being?"
Yeah, right? Because, they look, I'm outgoing, I'm not timid. So that, again, I think it takes individuals talking about, one, if you struggle with anxiety, depression, substance abuse, you just got to talk about it, right? Because I think that's the stigma in healthcare that, again, we focus so much on taking care of other people that we tend to shun ourselves, right? And that's personal health, that's mental health, that's, chronic disease. I mean, the list just goes on and on and on and on and on. And that's clinicians, right? And that's also folks kind of on the business side like me. And so, the more I think we can talk about how we're feeling, the mental health challenges, you see so many employers leaning in to create those outlets for people.
Yep.
I think the more we can talk about it, the more we can reduce the stigma on it. And I think the easier for it is for us to manage together. And, I'll talk a little bit about anxiety and my personal journey with that is that, for those of us that have never had anxiety or never had a panic attack, there is no way that anxiety could ever be explained to you if you've never experienced it, right? People just tell you to toughen up. It's like, "Oh, you get better. Like, go take a walk. Drink a sip of water. You need to go breathe in a bag." Like all those things. And I can tell there's people laughing watching this today. It's like, "Oh yeah, like I've heard all of those things," right?
Yep.
But again, I think the more we can talk about it, I think the easier for it is for us as an industry and as teams to identify the folks that maybe didn't realize that they had it or maybe didn't realize that they needed help. And I think the more we can talk about it, the more we can stave off that burning out. But honestly, Javier, what I worry the most about are the folks that flare out, right? And the way I differentiate it are the folks that build up, no barriers, no guardrails, stress, and they break, right? Gotcha. And they go into crises, right? They quit their job, they're not happy, they emotionally lash out. Those are the ones that worry me the most, are the individuals that flare out, because those are the folks that we've missed helping. Right?
Yeah.
Burnout is progressive over time. We all get crispy, right? We all have, tough weeks and long days and big meetings, right? But I think, one way to stave it off, or one strategy I try to use, is that, our phones have been a blessing in so many ways, right? But they're also a curse. Right. Yep. And so one of the things that my wife and I do whenever we have a chance to go on vacation, which is about once a year, is we intentionally try to go where there's no cell service. So you don't feel guilty picking up your phone. Right. And, you manage your time off and you try to unplug. And, the thing that, our team jokes about today that I need to make sure is a joke and not a real thing is, the rumor going around the office right now is, PTO stands for pretend time off. Right.
Okay.
And for some of us, right, at the executive level, PTO could stand for that. But again, that's for me, for my job as president of the campus, is that, hey, how do I create the space and the safety to where when people are off, they're off, unless the sky's falling, there's a major emergency, kind of things like that.
Yeah. Well, I mean, that's what, and to go into like leadership in general, leading by example, very critical to be, at least from my perspective, and I believe that you share a similar view on that, is that leading by example is really important. So if you want to have that change in your organization, you have to be the change, as well as then, obviously set up the boundaries and the processes to help initiate and carry out that change. Yeah.
No, I think you said that really well. And some of it could be the words you use, some of it could be the environment you create. And, a couple of things that I use when we talk about people taking time for them and taking time off and things like that. It's, I very much position it with my team is like, you don't have to come ask me if you can take off. I just need you to come tell me. And then when you tell me who's going to be covering for you so I can make sure I'm calling the right person and not bugging you while you're off, right?
Yeah.
And part of that, again, it goes back to the whole creating a safe environment where not just people feel empowered to take off, right? But people feel empowered to share feedback and raise safety issues. So a lot of those things kind of go hand in hand, but you can take advantage of that environment in a couple different ways.
With leadership as a topic in general and trying to set the example or effectively lead change.
Yeah.
Could you talk about your perspective on that and just what made you view the leadership in this way? Is there something that came up or something you read or someone you saw that crafted that view in your life?
Yeah, I think a couple different things. So I think there's always foundational training. Like we have to be trained as human beings to perform at a high level and have content knowledge, just like a pro athlete was, right? A hospital executive has to go through that same training, right? And that's just how to run numbers and how to manage reports and how to manage growth. But change is a huge part of what we do. And so for me, early on, again, during my time in Houston, as an organization, we leveraged ProSci and did a lot of training on crucial conversations and their change management tool, which is an acronym ADKAR, right? Mm-hmm. Awareness, desire, knowledge, ability, and everything there. And so what I do, and I had a lot of chance to practice it, is literally write out each of the letters, right? Okay, hey, if I have to go drive a big change, right? Mm-hmm. How am I driving awareness? How am I building that desire? How am I building that why? The knowledge, how am I giving the team the tools to be able to execute, right? And then ability, having them execute. Like what barriers do I need to move out of their way so that they can take that knowledge and turn it into action? And then how do I reinforce that, right? If we've kind of gone through the change. So I think being intentional around planning your change management, and that includes the calendar, right? The structure, the timeline, that includes the words you use. That's your stakeholder management. But I'll tell you, at least in my experience, and I've learned this the hard way, when you try to drive change without spending enough time thinking about the stakeholder management as it relates to who's impacted at the 6th or the 7th or the 8th or the 9th degree of that change, it's easy to framework, okay, hey, who's the person directly impacted and kind of the next two. But as you get out in the 4th, the 5th, the 6th, the 7th, the 8th person, that's where I see change management go a little worried, right? Because people are like, well, nobody told me, or, hey, you made this change here, and now I got to change my world. And so I think that's where you start to get that emotional kind of reaction to change if you don't spend enough time on change management. But for me, I had an opportunity to be a part of growing organizations my entire life. And, whenever you grow, build a new campus, add a new program, grow with a community like Dallas or Houston, right? That just necessitates a lot of change in systems and process and people and medical staff, all those things. So, over the course of my career, I've had a chance to practice it a lot. But to your question directly, had I seen somebody do it really, really well, and I have, right? And I've also seen people not do it well. You learn from it, right?
Right.
And I think for me and all of us as leaders, like we can all think back to changes that we managed really, really well. Like we just knocked it out of the park. Like everybody was on the same page. Like the results were awesome and it stuck, right? And then you go back to the ones that you've kind of filed away in the back of your brain that says like, all right, like I don't want to think about this, but I need to because it's similar. And then you kind of reflect on it. You were like, oh God, that was awful, right? Why did I do it that way? Why did I use that word? Why didn't I pick up the phone? And, I think, a big thing from a change management perspective and can be really impactful is especially when you're leading the change, right? If you're the person who's on the stage or sending the emails or on the Zoom or whatever it may be, having your story around the why and creating a compelling story about why we're doing what we're doing or what we need from everybody or how we're going to weather the change. I think that is a part that is difficult to master, but something that's essential, right? And again, talking about my time in Houston, I had an opportunity to work with Dr. Mark Boom there, who's the system president in Houston now. And Mark Mark is the best public speaker and kind of change agent with his voice and his presentations on really reinforcing where we're going, why we're doing it, and how we're going to get there, right? And so I had a lot of opportunity in the 11 years I was in Houston to watch and see Mark in action and learn more from his preparatory style of how he did a lot of those things. And so, totally selfishly, and Mark would be okay if I said this, I took some pages out of his book and have tried to use that, right? In addition to the duck analogy, right? In addition to, sympathizing and empathizing with frontline staff. And, as a new leader, you're not going to know the 7th and the 8th and the 9th domino. I mean, Heck, I've been doing this for 20 years and I still miss the 4th and the 5th one sometimes. But again, if you stylistically ask a lot of questions and spend time understanding the change in the department versus just leading from your desk or leading from email, that's a great way to really make sure that your change management is great and that the results end up being sticky at the end of it.
That's great. The first thing that comes to mind when you talk about change today is how can a young leader that's trying to make a difference help with change when you experience some of those things in a multi-generational workforce that healthcare has that other industries don't typically have to the degree that healthcare has. So young leader wants to impact change, is going through those different steps, and is going into working with the 20-year vet in the hospital. And they are in multiple different departments all over the campuses. Yeah. How would you approach it if you were the young leader today?
That's a heavy question. And, but it's a good one, right? Because as we look at, to your point, we have this weird donut hole in the healthcare workforce, right? Where you have folks that are in their 50s and their 60s thinking about hanging it up and retiring. And then your next largest part of the workforce is in their 20s and early 30s, right?
Yeah.
And literally, if you go back and you look at the generational science of, how those individuals grew up as individuals and how those individuals' parents grew up and, what crafted, those individuals' view of the world based upon, world events and technology and all those things, it's worldly different, right? And I won't get into the science and labeling generations, and all that stuff, right? Yeah. But, I think there's a couple core elements, Javier, that I think I would challenge younger leaders and really leaders of all ages, right? Whether you're a 40-something new to leadership or whether you're a 20-something that was thrown into leadership because it was right place, right time, or wrong place, wrong time, depending on how you look at it, is I think start with being humble. That I think is the easiest way to earn trust. If you can't earn the trust of your peers, of the folks above you, of the people that you lead, there's no way you're going to be effective at your role. And I think being humble, asking those questions, spending time alongside your team, spending your time starting to think about the domino tracks, right, of the decisions you make, or even if you're not having to make any decisions, what is the output or the input of your department? How does that impact down the domino stream? And my challenge would be, especially to young leaders that are hungry, that are aspirational, that, are CEO or bust before 30, is really kind of two things. Don't let chasing that next title or promotion impact your ability to be awesome at the job you have today. You have to be awesome at the job you are today, right? Yeah. And the big other piece about being awesome at your job today is don't be awesome in a vacuum. Bring people along that journey with you. This is so much of an industry where people are celebrated for their individual contributions, which is great because we have rock star individuals that do amazing things in this industry every single day across the entire world. But we can only do the greatest things when we're being awesome together. And if you're going to be an incredible leader, whether you're 24 or whether you're 64, you have to be able to manage up the people around you, have to be able to teach up, train up, execute up. And that is how you build trust from your team, by bringing them along a journey with you. And that's how you get noticed for that next role. The other thing I would challenge you on, that's kind of tied back with that, is that, everybody, especially who gets into leadership early, typically has aspirations to do bigger and better things. Remember, if you're 24 or 26 or 28 and you got your first management job, as much as this pains me to say, you got 40 years to get to the title that you want to get to. Right. And the last thing you want to do is, again, if you focus on being awesome and you do a really great job and you get noticed, the last thing you want to do is get moved up too quickly and get into a role that you're not ready for. So I would say lead at the pace at which you can learn. Always make sure that you're ready for the timing, right? Because we sometimes can create timing, but most of the time that timing is created for us or around us. Yep. But what we can be prepared for is to take advantage when that timing occurs, right? But don't push yourself to go from a manager, director to executive, or go CEO or bust before you're ready for the content that comes with that. the work-life integration. As you move higher in this leadership structure, and we talked a little bit about it earlier, kind of the lines and the guardrails between work and life get a little blurry. Mm-hmm. And so the last thing you want to do is stack on too much. You don't want to be 30 years old and be having your first or second kid, just buying your house, starting a new job, moving your family, having to learn a new board and execute a capital campaign all in 12 months, right? That's a great
Ideally
way to
not.
flare out, right? So pace yourself, right? You have your whole life to be awesome. And, again, going back to some guidance that I got from my mom, early on, and she still reminds me of it today because I need it, is, make sure as you're going through your journey, you're finding time to take a step back and smell the roses, right? And the meaning of that is just enjoy the journey that you're on, right? Yeah. And my other thought would be is that if you do accidentally get into a wrong role, I'm a huge believer you can do anything for 18 months. Right? Even if it's not the right role for you, even if you have a tough boss, even if it's not the content expertise, still focus on being awesome and being the best you can be, but do it for 18 months, right? It helps you tell a better story on your resume. It helps you rule in or rule out that this is or isn't what I want to do. And what it does is it builds a little bit of grit and toughness, right? Absolutely. There will be a point in all of our careers where, rather than follow the timing or rather than follow the path that's laid out for us in our organization, we have an opportunity to be more selective, right? Do I want to work here? Do I want to do this? If I'm interviewing for a role, is it everything that I want, right? We have an opportunity later in our career to be selective like that, but that usually doesn't come until you're really more kind of mid to late careers. So, I would say take advantage of the opportunities that are afforded to you. Don't chase the title, right? And continue to be awesome, not just on your own in a vacuum, right? But bring your whole team along that journey too.
So you bring up a really good point. So there's a lot of people that get opportunities that they're not ready for. Mm-hmm. How do you think that you knew that you were ready to make that next step? Because you might say, well, don't chase the title, don't be there unless you're ready for it. Yeah. But could you really be ready for something you don't know?
Yeah, there's a flip side. So no, I wasn't ready, right? But I think if you go into that mindset that you're not ready, it allows you, again, to be humble, to ask questions, ask for help, and all those things. And, it was a really funny story, meeting with my boss, Pam Stoynoff, who's our president and chief operating officer at Methodist Health System. She hired me into my vice president and chief operating officer role at Methodist Richardson, where Methodist traditionally does not take outside candidates. They like to grow people up from within. So, she was very clear in setting expectations around what she expected me to accomplish and how she expected me to get there and all those things, right? Love the clarity, right? She's wonderful at that. She's still my boss today. But I said, back in, late 2023, I said, hey, talked to my boss at the time, Ken Hutchenrider, who's the president of Methodist Richardson. It's, hey, I want to go check in with Pam, kind of get her gauge on how I'm doing and give some feedback. And am I meeting those expectations? And I remember I met with her for breakfast near her house in Southlake. And, we're sitting down and we're running through things, having casual conversations. And she said, hey, what do you think about Methodist Celina? Right. And, me not reading the question the right way, I said, oh, Pam, I think you and the organization had the great vision to put it in the fastest growing city in the United States. And, I think it's going to be a wonderful market for the health system. y'all did a great job. And she kind of sets her fork down and she looks at me and she goes, no, what do you think about Methodist Celina? And I almost melted through the chair, right? Because that wasn't the planning I had done for that conversation that morning. I didn't listen to my Pump Me Up song in the car on the way to breakfast that morning, right? But again, it was the timing, right? Yeah. The timing, I have right place, right time, right? But what I had done for the last 16 years of my career was prepare myself to take advantage of that timing, right? And it wasn't a one and done conversation by any means. I still had to interview and compete and all those things, right? But, again, I think you always need to assume that you're not ready for the role that you're being asked to move into. And that's just a great way to be a humble leader.
Sure.
That's a great way to be vulnerable on your blind spots. And again, you'll know when you'll know when you've mastered the content or the craft or the people. And when you get comfortable, find a way to make yourself uncomfortable again. And that doesn't necessarily mean changing jobs, right? Sure. They could be asking for more responsibility or kind of taking something that maybe was a lower priority project or task and pushing it up to the top. But yeah, I didn't think I was ready, and I've been very blessed, right, to have great support of the organization and a wonderful team around me that's allowed us to open at Methodist Celina incredibly successfully, over the last 2 months.
So being in the leadership roles and being in different roles that surrounded good leaders, one of the things that I tell people is that I always say, just get past the first 6 months as a new leader. I don't know what your timeline is or what you feel about that type of statement, but I think that there's always a initial grind and really tough period for new leaders that you really have to kind of, to your point, get through 18 months, or just do 18 months. Anybody can do that. Yeah. And when you get into a new role, even if you feel like you're ready for it, sometimes you're not going to know what's on the other side of the fence until you make that jump. Yeah. So just know that for the first 6 months, this is my personal advice to anybody, is get through that first 6 months and really put everything you've got into 6 months. Because once you do, then I feel like after that, you get a lot more clarity and things become a little bit more, I'm going to say easier, but things start to smooth out.
Yeah, I think that's really great advice. And what I would even boil it down further, and not every role or environment or organization allows you to do this, but if you have an opportunity to not make any significant changes for the first 90 days, don't make any significant changes.
That's a good one.
And part of it is that, to your comment on really getting comfortable and kind of understanding over those first 6 months, I couldn't agree more, is you want to make sure you understand how the machine operates before you go start messing with stuff. And it takes time. You got to develop the relationships. You got to learn the systems. You got to, I was jokingly saying earlier, you got to learn where the bathrooms are. You got to learn where to get something to eat. You got to learn where to park your car. That can take you 30 days, depending on how big or small your organization is, right? And so I think you take it in baby steps, right? But I do think, I think in my experience, once you really surpass that 180-day mark, you really have that foundational comfort, and you know where the skeletons in the closet are, you know where the pesky problems are, you've had an opportunity to identify maybe the employees or the other leaders on your team that maybe you need to lean into more, right? You've also recognized the people who might be your rock stars, and you just give them everything that they need and get the heck out of their way, right? But I think that 6 month is a really good inflection point, and I would challenge everybody is that 6 month mark too, is yes, you feel comfortable, but I would also take some time to be introspective or retrospective on that and go seek input from people similar to a 360, or find your confidants or your mentors and have that intentional, vulnerable conversation to say, how have I really done over the last 6 months? And don't tell me I did great and everybody loves me and everybody's awesome. Tell me how I really did. Right. And I think if you can find those people and surround yourself with those people that will give you real feedback, that'll help you set your individual targets and goals outside of your business goals for the next 6 months about what you want to work on for you. And I think that's just a good cadence is, every 6 months, go ask those questions, right? Whether it's with your human resources partners, your boss, your mentors, whatever it is, and find those people that'll give you real feedback. If you find yourself asking those people every 6 months and they're telling you you're doing awesome and everything's perfect and oh my God, the world would end if you weren't there, you're not talking to the right people.
That's what I was just about to ask that. How do you know that you're getting real feedback?
Yep.
Because I feel like that a lot of people will say, you don't know depending on when you catch them. Yeah. And I don't know if you have a suggestion to people about catch them at breakfast, catch them at lunch. I feel like it's very difficult sometimes to ask people to grab lunch, to grab dinner, or to grab a meal outside of work because everyone's so busy. You try to do the balance. Yeah. So how did you work that into your career?
It's got to be multifaceted, right? And again, if you're in a role where you lead alongside or partner with the medical staff, sometimes that may mean meeting them at 6 a.m. before first case start, or sometimes that may mean going and catching them in the doctor's lounge at lunch or after work or whatever it is. But I think that's where since you're seeking on ways to improve you have to be the one to be the most flexible. And, if you're struggling with it, make it a little bit more formal. Right? Set up a meeting, call people in and open the conversation with, hey, I really am, wanting to work on me and really am trying to seek out some good feedback and be introspective and really want you to be honest and transparent. Is that something you can commit to doing for me? And you'll have some people say no. Yeah. Right? Because some people hate sharing feedback, right? Or you have the people, they'll immediately respond and say, oh, Javier, you're wonderful and great. So it's okay, that's cool. Thank you for the praise. Always say thank you. But find those people that'll be real, right?
Yes.
And the people that'll be real with small stuff. It's like, hey, I wish you wore a tie more, right? Or, hey, in the meeting, you use a lot of verbal crutches like uhs and ahs and right and all those things. Or, hey, I don't really like the way you put your PowerPoints together. Like, find people that'll pick at you like that and just be prepared to hear the feedback.
Right.
And figure out what you want to change. Just because you get feedback or criticism doesn't mean you need to embrace all of it.
Sure.
But find those people who'll give it to you. And for me, right, I've always leaned in very closely to my executive admins, right? Because they'll tell you the real, right? They'll tell you you're being too busy, or that, hey, your suit jacket doesn't match your pants, or, hey, I listened to your speech the other night and you should have talked about this. Like, find those people that are honestly want to give you real feedback to help you with you.
That's awesome. That's great advice. So in closing, what would your final thoughts to future leaders be?
Yeah. I'll go back to a couple things that we talked about kind of during our discussion today. And I would say you always have to be ready for when that timing creates itself, right? We as individuals can sometimes create our own timing, but we're all walking through a path that's been laid out in front of us. And so we may not know when that right time or that next right best time is. But what we can always do is we can always prepare us. And, I come back, I had great mentorship during the course of my career, and Kathy Easter, who's our president and CEO of Houston Methodist Global Healthcare Services, where I was before coming to Dallas, I would always go to her for advice on that. Say, what do I do? And where do I go? And how do I be prepared? And, she gave me some really tough but meaningful advice. And I think it's good for our closing today is that, she would challenge me regularly and say, Cody, you're the CEO of you. Nobody else is the CEO of you but yourself. And that's a decision you have to make. That's a feeling that you need to come to. That's the readiness that you need to own. So I would really say, take ownership of you, be the CEO of you. Don't let the world influence you. Don't let, what social media says you need to be when you grow up. Don't think that the only way to be successful in healthcare is by being a president or CEO. That's all farce, right? But you have to come and decide what's best for you, right? So I would say start there, know yourself, and make sure that you are the CEO of you, not with the board of directors, right? It is unilateral. You are the boss, and you got to make sure you embrace it. And then probably I would say the second thing that I think will help give, or at least it gives me a lot of personal satisfaction is, recognize that wherever you're at in your journey, you did not get there by yourself. You had individuals or tribes of individuals help you on your journey, whether that's education or growing up or social infrastructure or family infrastructure, whatever it is. And I would challenge you, whether you're in leadership or a clinician, identify those opportunities to lean in and create those moments where you can mentor and help other people. This industry is so complex and it's so big and it's so complicated that it's impossible for one person to know everything, right?
Yeah.
By leaning in, though, and creating those opportunities for mentorship, always responding to that LinkedIn message, always responding to that email, always taking that phone call. It'll create these wonderful moments for you and can impact the course of your career because you never know how big your network can be or when you may need to leverage that network until you're saying, well, who's in my network, right? That might be able to help me with that, right? So those would be a couple of things I would encourage folks to focus on.
So all of it's great. Everything from the beginning to the final has been fantastic. Cody, thank you so much for spending some time with us today. And I can't wait to see what Methodist Celina does in the future.
My pleasure. Thanks for having me out, Javier.
All right.
Appreciate you.
Thank you.